Hi, this is Jim Hoffman from the EMSprofessional.com. This is a quick overview video of COPD, or chronic obstructive pulmonary disease. COPD is a lung disease in which the lung is damaged, making it hard for patients to breathe. In COPD, the airways, or the tubes that carry air in and out of the lungs, are partly obstructed, making it difficult for air to get in and out. Cigarette smoking is the most common cause of COPD. Most people with COPD are smokers or former smokers. Let's take a quick look at this video. The airways branch out like an upside-down tree. At the end of each branch are many small balloon-like air sacs. In healthy people, each airway is clear and open. The air sacs are small and dainty, and both are elastic and springy. When you breathe in, air sacs fill up with air like a small balloon. When you breathe out, the balloon deflates and the air goes out. In COPD, the airways and the air sacs lose their shape and become floppy. Less air gets in and less air goes out. In the end, what this winds up happening is that the airways and the air sacs lose their elasticity like an old rubber band. The walls between many of the air sacs become destroyed. The walls of the airways themselves become thick and inflamed or swollen. Cells in the airways make more mucus or sputum than usual, and this tends to clog the airways. COPD develops slowly, and most of the time COPD is diagnosed in middle-aged or older people. Some other names you might see for COPD are chronic obstructive airway disease and chronic obstructive lung disease. The two primary diseases included with COPD, especially in the United States, are emphysema and chronic bronchitis. In the emphysema type of COPD, the walls between many of the air sacs become destroyed, leading to a few large air sacs instead of many tiny ones. Then, the lung winds up looking like a sponge with many large bubbles or holes in it, instead of a sponge with very even tiny holes. These few large air sacs wind up having less surface area than the normal tiny ones for air exchange of oxygen and carbon dioxide. This poor exchange of oxygen and carbon dioxide is what causes shortness of breath. In the chronic bronchitis type of COPD, the airways have become inflamed and have thickened. There is an increase in the number and size of the mucus-producing cells. This results in excessive mucus production, which in turn can contribute to coughing and difficulty in getting air in and out of the lungs. Most people with COPD also have emphysema, and you will see most of them will have chronic bronchitis and emphysema. I hope you enjoyed this quick presentation from the EMSprofessional.com. This video that you saw within the presentation can also be seen separately on the members only website. This actual entire presentation, along with many others, including audio, downloads, and other practice and EMS resources, can be viewed at the EMSprofessional.com, which is a members only website for EMS providers.